Assalamualaikum warahmatullahi wabarakatuh, and very good morning. I'm Dr. Rozanizam Zakaria, psychiatrist and lecturer from Kuliah of Medicine, IIUM Kuantan. So in today's session, I will share with you a basic video on introduction to psychiatry. So this video is one of my teaching materials for my undergraduate students, year 5 medical students who normally undergo psychiatry posting for 8 weeks duration. So whenever they start their posting, some of them will feel overwhelmed with so many things that they need to know. So I will normally give this kind of introduction or briefing to them so that they know the bigger picture of psychiatry. So nevertheless, even though it's meant for my students, whoever you are in psychiatry field, medical doctors, housemen, you can still learn something from this as something for the introduction. So what I'll be covering in this today's session is how do you approach psychiatry in general, and how do you make sense of DSM 5, and one of the fundamental resources that you need to be familiar with whenever you are dealing with psychiatry subjects. So that's what we're going to discuss today. So I'll be using my whiteboard as my most sophisticated teaching materials today. So hopefully you will still be able to capture some of the important points. So I use videos so that you can pause whenever, you can write down things, and then you can review this back again and again. Now, psychiatry, like any other posting, is meant about two main things. So you have patients and you have two main important things that you need to do. One is your job is to diagnose them, to make sense of their experience so that you can translate that into a specific diagnosis, because without diagnosis you cannot proceed to the second task, which is managing them. Alright, so this is generally the role that you have to pose in any part of medicine. But what's interesting about psychiatry is this part is slightly different to other part of medicine, in which we rely more heavily on history taking as opposed to examination or investigation. So normally in psychiatry, examination in particular, we highlight on mental state examination. Its function is primarily to support your history, and investigation is predominantly used to exclude other differential diagnoses. So that's how it works. So you need to go back to the principle of psychiatry, of medicine, which is history taking. Now, why does history taking matter in psychiatry? So whenever we talk about diagnosis, of any illness, there are two types of the two general ways of we diagnose any illness. Okay, so number one is by the pathology. Okay, so for example, you have meningitis, for example. Okay, meningitis. So you have this at the back, which means inflammation, some sort of inflammation, and meninge at the front, referring to the specific parts of the body, which is meningeal. So by naming the diagnosis as meningitis, you can have some idea that it's actually occur as a result of inflammation of the meningeum. So same as tendinitis, same as appendicitis. So we diagnose certain illness based on the pathology that involve. Okay, but there are other illnesses that falls under second category, in which we do not diagnose them based on organ, or we do not diagnose them based on the pathology. Okay, and the reason for this is because there are illnesses that has a multifactorial in nature that attributes to its disease formation. So for meningitis, you cannot put it to any other illness, any other disease, because that's what it is. It's inflammation in the meningeum, and it's an inflammation. It cannot be due to any other things, and you you can exclude further whether it's due to viral, bacteria, parasite, and whatnot. But the general idea is it's the infection of certain part of the body. Okay, but there are illnesses who do not have a specific attribute to it. Okay, for example, you have Parkinson disease, for example. So Parkinson disease do not have a specific pathology. It's idiopathic in nature. So how do we diagnose Parkinson disease? So we diagnose them based on set of symptoms that we call syndrome. Okay, so a second type of illness, we do not diagnose them based on pathology. We diagnose them based on syndrome, which is a collection of symptoms. So for Parkinson, you're looking for bradykinesia, you're looking for tremor, you're looking for cogwheel rigidity. So if you have all these three, then you have Parkinson disease. So it's a syndrome that allows us to diagnose this illness. Now, psychiatry majority of diagnosis in psychiatry falls under second category. Reason being, number one, we do not have a specific organ that we want to pinpoint, whether we know that some changes happen in the brain, but it is not the disease of the brain structure, it is the disease of brain function instead of structure. And second, we do not have a specific etiology. We're not talking about infection, we're not talking about electrolyte imbalance, we're not talking about damage due to the injury. So most of psychiatric illness occur due to different pathologies, different etiologies, which are multifactorial. We have biological predisposing factors, psychological predisposing factors, we have social predisposing factors, and which all integrate into eventually one form of illness. So therefore, when we look into psychiatry, we're looking at this second type of illness. So therefore, in order to diagnose them, we need to understand what are the syndrome, which basically means what are the symptoms involved. So for the first type of illness, we can go specific to the organ. So that's why we use mainly investigation in order to confirm our diagnosis. Or we can go to the pathology itself. So if there's an infection, then we can culture the sample so that we can see what's growing from the samples. So therefore, investigation plays a significant role. And same goes to physical examination. So you have areas of the bodies that you can look at. So you have liver pathology, then you can measure the liver expand. For example, you have eye pathology, you can look at the eye, back of the eye, front of the eye. But in this form of illness, psychiatry in particular, we do not have a specific organ that we can view. And so therefore, we need to put a particular attention into the collection of symptoms that patient have. So that's why in psychiatry we come up with something like this. So this is called DSM. So what you have is probably a mini version. This is the original version of DSM, which encompasses all the diagnoses that falls under mental illness or mental disorder category. So what do we have in here are the diagnostic criteria, which basically the collection of symptoms that patients with mental illness present with. Okay, so that's the first part or the introduction to psychiatry that you need to be aware of. Alright, so now that we know to diagnose psychiatry diagnosis, we need symptom that later become a syndrome so that we can diagnose. So what we do in psychiatry is we outline the criteria into what we call the DSM criteria. So for any illness, you will find it under DSM criteria. For schizophrenia, for bipolar, for MDD. So there are other classifications, ICD-10, ICD-11 for example, But for the benefit of this discussion, I'll be focusing on DSM-5 so that you'll get some idea on the concept of it. Okay? So now, in order to understand how to diagnose a specific mental illness, you need to first understand what is outlined in DSM-5. So that the idea is you understand DSM-5, okay, and patients will share with you their experience, and your role is to bridge between these two. Okay, so patient will not come to you describing the DSM criteria. They will describe that they are sad, they lost interest, they cannot sleep, they don't have appetite, they lost weight, they feel hopeless, they feel suicidal. So that's their experience. But based on history that you gathered, knowing that you understand major depressive disorder criteria in DSM-5, you'll be able to match these two, and therefore eventually diagnose the patient to have MDD. So that's the whole process that takes place during psychiatric clerking. Alright, so in order to do this, there are two important skills that you need to know. Alright, so skills number one is skills to understand DSM. So you need to understand DSM. Number two is your clerking skill. Alright, so by clerking, you ask the right questions, you get the right answer. With the answer from the patient, you can match based on what you've understood from the DSM-5. So if you understand the DSM-5 but you have poor clerking skills, you won't be able to get to patient's problem. If you're very good with patients like you have very good empathy, but you have poor knowledge on the DSM, how to interpret psychopathology, how to relate with certain diagnosis, then you won't be able to capture patient experience into diagnosis as well. So we'll do both. So for the first video, I will highlight this. Okay. So the other video we will discuss about clerking. Okay. So this video is just about how to make sense of these resources, DSM-5. Alright. Now, DSM-5 categorizes so many illnesses. Okay, so this weigh roughly around 2.4 kilos. So there are almost 200 plus diagnoses of mental illness. It's hard for you to remember all of diagnoses available there. For medical students, you are meant to you are expected to know basic diseases or basic concept of illness. So how do we start? Okay, so the first concept is to understand that at the end of the day, diagnosis of mental illness falls under this group. Okay, so whenever you feel lost, just go back to this basic. Okay, whenever you don't know where to start with your diagnosis, just remember this concept. Okay, now diagnosis of mental illness falls under three main criteria or three main cluster of symptoms. Okay, so symptoms number one, we call it psychosis related. Psychosis related. So psychosis basically means when you lost touch with reality, you cannot differentiate what's real and what's not. So the symptoms are delusion, hallucination, disorganized fiction, disorganized behavior. So those are some of the symptoms. But the main criteria is psychosis. Second group of symptoms is mood related. Okay, mood. So one extreme is depression, another extreme is manic, and everything in between falls under mood disorder. The third one is anxiety. Okay, so anxiety is emotional state characterized by physiological changes, emotional changes, cognitive changes, behavioral changes that relates to the state of being alarmed, stressed, anxious. Okay, so that's anxiety. So you need to understand what are the symptoms under each of these that will go on to rate on basic psychopathology or phenomenology, we call it. But these are the main group. Okay. Now, why do I make such such description or figure to illustrate the symptoms? Number one, you can see there are some overlap of symptoms. Okay, so some diagnosis has pure psychotic symptom, some diagnosis has pure mood symptom, some diagnosis has pure anxiety symptom. But there are diagnoses that has overlapping symptoms between psychosis and mood, or mood and anxiety. Okay, we'll talk about it in a bit. Now, another important cluster of symptoms that you also need to know is psychiatric related disorder due to substance and due to medical problem or medication. Okay, so substance or medication, a medical problem. So whatever diagnosis that you're going to come up during your clerking, it will fall roughly around this. Okay, it will cover most diagnoses, especially for adults. There are other diagnoses that we won't cover under this, like children and geriatric cases, but generally for adults, these are the main cluster of symptoms and diagnosis. Okay, now let's have a look. Now, for psychosis, you have a few diagnoses. For example, you have schizophrenia here. Okay, so if you talk about schizophrenia, you also have brief psychotic disorder, you have schizophreniform. So that these are the diagnoses that falls under psychosis. Okay, for mood, you have MDD, for example, and then you have bipolar mood disorder, type 1 and type 2. Okay, for anxiety, of course, you have panic disorder, GAD, you have social anxiety disorder, you have specific phobia, you have agoraphobia. Okay, so that's under anxiety. And then what's in between? So in between, you have something like, for example, mood disorder with psychosis. So you have major depressive disorder with psychosis. You have schizoaffective, for example. So schizoaffective, basically schizophrenia plus affective symptom. Affective is mood. So you have schizoaffective, for example. Okay. So here you have mood depressive disorder with anxious distress. For example, you have mood disorder that have anxiety symptoms. So there are some anxiety disorder that present with mood symptom as well. And for example, you have PTSD. So predominantly anxiety-related symptoms. It is not classified under anxiety disorder in DSM, but the diagnosis has anxiety components and mood component. Okay, so you have diagnosis of adjustment disorder with mood, adjustment disorder with anxiety, for example. Okay, so these are the geographical location of diagnosis based on this pathology. All right. So, for example, whenever you come across patient with psychotic symptom, when you want to think about differential diagnosis, then you can look at this part of the figure. So, you have options of schizophrenia-related diagnosis, you have options of psychotic and mood-related diagnosis, and you have psychosis due to substance and psychosis due to medical. So, by using this framework alone, you will not have trouble to come up with at least 2, 3, 4, 5 differential diagnoses. Because remember, differential diagnosis is important to expand your search for the true diagnosis. So you cannot zoom into one diagnosis alone. So in exam, for example, we're looking for your ability to analyze other potential areas that you need to look at. Okay, because differential diagnosis serves the purpose of concept of diagnosis in psychiatry, which is diagnosis by exclusion. We need to ensure that you have excluded everything before we decide that it is actually what it is. Another example, if you have case of mood, for example, you have case of mood. Okay, so patient presented with depression with some other features. Then you need to think along this line. Is this MDD? Is this bipolar? Could this be something related to anxiety? Could this something related to psychosis? Could this something related to substance? Could this something related to medical? Okay, so on this alone, okay, you can have some ideas about what are the potential differential diagnoses that you can come up with. So this is the area of diagnosis. Okay, so that's where we sit in. So just absorb that concept first before we move on to the third part of this video. Alright, good. So now we move on to understanding DSM. Alright, okay, so understanding DSM. Now, if you have DSM with you, let's just have a look at one of the diagnoses. Go through your DSM-5, open up section on psychotic related disorder, look at schizophrenia. Okay, we'll start with schizophrenia in order to grab the concept of DSM. Now, if you look at this schizophrenia, to diagnose schizophrenia, there are 6 categories there are 6 criteria, okay, or features required. So A, B, C, D, E, and F. So criteria A is symptom based. It outlines to you what are the symptoms. Okay, so it's stated in there. If you look carefully, you need at least 2 out of 5 of the criteria. So delusion, hallucination, disorganized speech, disorganized behavior, and negative symptom. Okay, and it also states there you need to be careful when choosing these 2, because at least one of these 2, okay, need to come from either the first 3. It has to be either delusion, hallucination, or disorganized speech. Okay, so that means if you have only 2 symptoms and your symptoms are negative symptom and disorganized behavior, you are not yet able to diagnose them as schizophrenia, because the diagnostic criteria says so. So which basically means the first part is about understanding psychopathology. Okay, so you will not be able to fulfill criteria A if you don't know what delusion is, what hallucination is, what constitutes disorganized speech, disorganized behavior, / catatonia, negative symptoms. Okay, so in order to understand DSM-5, you need to first understand psychopathology. We'll talk about psychopathology in a bit. Okay, so that means basically among your first steps in psychiatry is to get the concept of psychopathology. Okay, and it's simple. With psychopathology, what you need to know, you need to know the name of it, you need to know the definition of it, you need to know the examples of it. So once you get a grip on this concept, then you'll be able to appreciate. For example, delusion. So delusion is a false fixed belief that is unshaken despite contrary evidence, and it is not in keeping with one's social, cultural, or religious background. Okay, so that's basic definition. It has to be a thought, something that they believe. Okay, so that's definition, and then you need to know the example. So under that you have persecutory delusion, you have grandiose delusion, you have somatic delusion, and you have delusion of guilt, you have nihilistic delusion. So if you know this basic concept, then you'll be able to appreciate delusion. So that's number one. Number two, it says that the symptoms is significant enough to affect one's function. Okay, so we talk about functionality. Because most symptoms in psychiatry, some of them are symptoms that everybody experiences. For example, in depression, you have sadness. So everyone has experienced sadness in their life at some point. But what makes it pathological is when it disturbs function. So how do you assess functionality? So based on three. Alright. So number one is your personal function. Personal function is your ability to look after yourself. So your sleep, your ability to your appetite, your ability to look after your hygiene. So these are personal. Okay. Number two is your function in terms of how you react with others. So we call that interpersonal or social function. Number three is your ability to perform duties. So for example, if you are students, your academic. If you are workers, you are expected to be able to do your occupation. If you are a mother, you're expected to, if you're a housewife, you are expected to be able to manage your house chores, for example. So whenever the symptoms disturb this function, then you basically fulfill the second criteria. Alright. Number three is talking about time frame. Okay. So every diagnosis will have a different set of time frame. So for example, for schizophrenia, we talk about 6 month duration, in which during that 6 months, the symptom must be continuous at least for 1 month duration. That means it cannot be once in 6 months. But for 6 month duration, you can have some periods where you don't have symptoms, but cumulatively the symptom present for more than 1 month for 6 month duration, including deterioration in function. Okay, so function affected for 6 months also counted as fulfilling the time frame of 6 months. Right. Now we come to D. Alright, so in criteria D and criteria E and criteria F. So these three criteria falls into one specific rule, that is exclusion. Okay, that means if you have these symptoms for that duration and it affecting your function, you cannot call it schizophrenia unless you have made sure that these are not due to something else. Okay, that's what it meant by diagnosis of exclusion. Okay, so D, you need to exclude that it is not due to other primary psychiatric problem. For example, MDD with psychosis or schizoaffective, for example. So which basically means if you have patient with psychosis, patient has delusion, patient has hallucination, unless you have excluded depression, you cannot say it's schizophrenia. So you need to think about, could this be MDD with psychosis? If you have made sure that this is not MDD with psychosis, this is not schizophrenia, then only you can proceed to possibility of schizophrenia. Number E, you have to exclude substance or medical as the cause of that diagnosis. So for example, if patient experience psychosis then, so that psychotic symptom, before that patient had motor vehicle accident that caused traumatic brain injury. Now, if this is the case, then your diagnosis should not be schizophrenia. Your diagnosis should be psychosis due to another medical condition, which is TBI. So provided that provided that you have online. Provided that the medical condition that you experience is responsible for the production of the symptoms. Okay, so remember this very important concept. Okay, sorry ada iklan tadi. Ada tetamu tidak diundang. Okay, ataupun patient develop psychotic symptoms. Not long before that, patient takes cannabis, for example. Now, in this case, you must attribute the psychotic symptom to cannabis rather than schizophrenia, unless you have other features to say that this is not due to cannabis. The cannabis is just there for whatever reason. We'll talk about it in different video when we discuss about substance-induced psychosis. Okay, and F is another spatial exclusion that don't normally exist in other diagnostic criteria. So in schizophrenia, you also need to exclude neurodevelopmental disorder that can also mimic psychotic presentation. So in DSM, they give example of autism spectrum disorder and communication disorder. Why? Because in autism spectrum disorder, patient may manifest a disorganized speech and disorganized behavior. Okay, patient has echolalia, patient has rocking body movement, for example, that can be misinterpreted as stereotype in schizophrenia. So, if patient has these symptoms and at the same time has history of autism spectrum disorder, so therefore you cannot diagnose schizophrenia unless you have fully excluded this. Okay, all right. Now, if you look at this, just absorb this for a moment. Okay. So if you understand, at the end of the day, whatever diagnostic criteria in DSM, you take MDD, you take anxiety disorder, panic disorder, whatever that is, at the end of the day, under the diagnostic criteria falls four main important aspects. Number one, you need to know what are the symptoms to diagnose. You need to know what are the time frame, and you need to know what to exclude. And at the same time, for each diagnosis, there will be a specific. It will require evidence that function is affected. Okay, so that is